All right, hello everyone, and welcome to today's webinar sponsored by the Northwest ATTC, the Pacific Southwest ATTC, and the Western States node of the NIDA Clinical Trials Network. My name is Meg Bruner, and I'll be your host for today. And we're very excited to have Dr. Noel Vest, an assistant professor at Boston University School of Public Health, here to talk to us today about the rarely discussed impact of collegiate recovery programs in the US and Canada. A couple of quick housekeeping things before we get started. First, if you have any questions for Dr. Vest during the presentation, you can put them in the chat and we'll answer them after the talk. Next, you'll also be getting an email at the end of today's webinar that has a link to a survey in it. Please take that survey. It helps us make sure we continue to bring you content that you're interested in. That email will also have a link to download the slides from today and a link to the Northwest ATTC website where you'll be able to find a recording of the webinar later this week. Additionally, when you registered for today's session, you marked the type of CE or CME credits you were interested in. For CME credits, you'll receive an email with instructions on how to log into the Stanford CME portal, as well as some other instructions. This slide just has some information about the CME accreditation, and so does this one. This is all coming to you later, so don't feel like you need to take notes. If you selected one of the types of CE credits, you'll receive an email shortly after this session with instructions on how to receive those. And all this information, again, is coming in the slides later today, so no need to write anything down. And then finally, those of you who requested a certificate of attendance will receive that automatically by email in about a week. All right. Today's speaker is Noel Vest, PhD. He is an assistant professor at Boston University School of Public Health. His research focuses on mental health, substance use disorders, and addiction recovery. Dr. Vest earned his PhD in experimental psychology from Washington State University and completed a NIDA T32 postdoctoral fellowship at Stanford University's Department of Pain Medicine. Welcome, Dr. Vest. We're very excited to hear from you today.
Thank you very much. Thanks for the warm introduction, and I'll just start off saying special thanks to the Northwest and Pacific Southwest ATTC and to the CTN Western States node, which I still claim to be a part of, though I am way out on the East Coast now, but definitely got my start with the Western States node while I was at Stanford University. And so I just want to say thank you for this opportunity to present on this work. I'm going to be about some of the research that I've done on collegiate recovery programs across the US. So I always like to start out with my special thanks. So my special thanks, and I know a lot of people do this at the end of their presentation, but that's why I like to do it at the start of my presentation so that I don't forget it. And so a special thanks to both my family and my wife. Without their support, I would not be anywhere close to where I am today, and my entire career is really dependent on their support. And so I want to start out with that. Thank you. And then I'll just talk briefly about funding and disclosures. So again, all of this work that I'm presenting today, all 6 papers that I'll present today, is work that's supported by K Award through the National Institute on Drug Abuse, aimed at trying to characterize collegiate recovery programs in this country. So I think it's always important to start out kind of just talking about just the continuum of care for substance use disorders in general. When we talk about different types of treatment, different types of funding, primarily resources for collegiate recovery programs. When we think about it in this context, right, whether it's, and again, this can be, I know I put up there substance use disorder continuum of care, but this could be for any disease, continuum of care. How we generally think about it in the US is we kind of have pots of money for the prevention of that disease. We have pots of money for the treatment of that disease, and then we have pots of money for the recovery of that disease. And so substance use disorder is no different. And we think about the types of services that we have for substance use disorder. Another important part to understand with collegiate recovery programs is we're primarily talking about a developmental period of emerging adults and young adults. And though this age group is crucial for understanding substance use disorder, I would say just in general, this is an area that is very often kind of ignored. And so again, I think it's really important to understand the continuum of care and the developmental period that we're talking about, because it does kind of play into all of the research that I'm going to be presenting here today. All right, so I'll start off with this question of why do we need collegiate recovery programs, and never cover why we need collegiate recovery programs in such a short time frame. I will work my best or do my best to give a really good overview of why we need them. And so the first few slides are really just kind of to lay the groundwork and to get us on the same playing field of why we may need these. So as I mentioned in the last slide, as and I'm sure many people on this call can understand that this developmental period of kind of the college years tend to be a developmental period that is highly impressionable and really tends to be driven a lot by social perceptions. There are many different reasons for this. I think a couple of them that kind of come to mind is that this is a lot of times the first time these students are away from their parents and away from other maybe protective factors that kind of play themselves out in the home. And then, you add this kind of new environment, the lack of parental oversight, and then the influence of the alcohol industry that's really kind of driving this harmful narrative that college tends to be about substance use that is kind of geared towards partying and geared towards having fun at all costs. And this really does play out, and I don't have a whole lot of time to dive into any of this research today, but there's a very extensive research base on the norming of college student substance use, which again is kind of given an adrenaline shot by the alcohol industry. And so I don't think that it is a big surprise to anybody on this call that college is just in general a tough atmosphere to reduce or stop using substances. I think that more specifically underage drinking, it remains this what I would say is almost a unique public health challenge, at least here in the U.S., where despite it being illegal for most college students, it is socially tolerated, and I would say to a degree like culturally normalized, so that in reality not using substances is often seen as radical in this environment or outside of the social norm within this environment. You'll hear that from a lot of people, in early recovery, that they feel like outcasts that within the college environment, that they get looked at weird for not using substances or looked at sideways for not using substances. And so I think that again, it just creates this kind of unique environment that is really difficult for individuals to try and enter into recovery. All right, so we've touched a little bit on why. So now we'll jump into a little bit about what collegiate recovery programs are. And again, this is another situation where I could never cover what they are in really such a short amount of time. But again, I'll try and do my best to give an overview. I'll go through three, I would say, fairly well-established programs that are out there. I think that these are universities that many people have heard of, and I'll kind of go through the what is kind of, I would say, the galvanizing force of each of these programs, and again, just kind of give you some examples of some collegiate recovery programs that exist across the U.S. But generally, when people ask me, like, how would you define a collegiate recovery program, I really can't give a great definition. I think that I generally say that any resource that a college can provide to a student in recovery would, for me, be a collegiate recovery program. It's basically you're providing resources for a student with a condition that is going to aid in them not only doing well in school, but also doing well with the condition that they have. And so that's how I generally define it, but other people may define it differently. This idea that is any resource to help a student in recovery. So the first example school that I'll kind of talk about is probably the most well-known collegiate recovery program in this country. This is the Collegiate Recovery Program at Texas Tech University. This is a very resource-rich, I would say, program. They have a $40 million endowment that they draw from that keeps their day-to-day operations kind of going. And as I was mentioning, I'm going to kind of talk about these three different programs because they really kind of revolve around, like I say, this galvanizing source, but they revolve around a specific aspect of the collegiate recovery program that I think is important to kind of take in, especially when we talk about some of the contextual things that we'll talk about later. But for the Texas Tech program, everything really revolves around what you see in this picture here. This is their student drop-in center. It's a beautiful 3-story building right in the middle of campus. They hold multiple mutual help meetings there. They have a plethora of different kinds of mutual help meetings. They have AA, NA, Celebrate Recovery, All Recovery. And as you can see in this picture, they also do a lot of sober activities. Happens to be a sober tailgate, which they do before every Texas Tech home football game. Again, a chance for the community to kind of come together in an activity that would kind of normally, I would say, include a lot of substance use and allows people to have this safe space, I guess you would say, for individuals and students that are in recovery. They also do a lot of academic support from this building as well. But again, this particular program really revolves around this student drop-in center. So the next program that I'll bring up is the program at UCSB, or University of California, Santa Barbara, and where Texas Tech really focused on the student drop-in center. I would say that UCSB really takes pride and focuses on their peer recovery supports. They have a total of 4 peer workers within their collegiate recovery program. They have 2 recovery peers, so 2 students that kind of work with students in recovery, and then they also have 2 overdose prevention peers that do a lot of the outreach regarding or including distribution of fentanyl test strips, distribution of Narcan on campus, and these 4 recovery workers really kind of work in unison and really kind of feed off each other. And it's a very unique program in that they really have these great peer support services, and they really kind of work together and coordinate a lot of the work that they do, and so just a very interesting program. And so the last collegiate recovery program that I'll kind of use as an example is the collegiate recovery program at Stanford University. And so where Texas Tech revolved around the student drop-in center, UCSB revolved around kind of the peer supporters or peer workers that they have. The program at Stanford really revolves around this well house, which is a substance-free housing unit right in the center of campus, where about 30% of the individuals that live there identify as students in recovery. And so in this particular situation, it's the house itself kind of that provides the support, along with they have weekly recovery meetings, weekly kind of sober activities that they do a lot of in the well house. But this one, again, kind of really revolves around this substance-free housing unit. And all of the resources and programming that they have really kind of stems out from that. So as you can imagine, these three programs are very well-funded programs. And I would say that even being well-funded is really the exception to the rule. Most schools are very, very lucky, I would say, to even have one mutual help group on campus, or perhaps even a few substance-free activities. And so, again, I give you these examples, but they can be the exception to the rule. So I think that we've got a pretty good understanding of kind of what different types of collegiate recovery programs. And so I'm going to dive into some of the work that I've done. And again, this is all work that was completed as part of my KO1. And so this first paper was actually done while I was writing this, the KO1, as you do when you're involved, really wanting to get involved in research in an area that may not be your focus area. The first thing that I wanted to do was to do a scoping review. In a scoping review, like I'm sure most people here understand, the scoping review is the type of review where we kind of gather up all of the research in an area and try and summarize what currently exists in the literature. And so, again, a very broad swath of what currently exists in the literature. And so, what we found. That work. What we found was that there was some core components to these collegiate recovery programs, and again, it really kind of I think piggybacks onto what I presented in the last slide, where you have these core components of peer supports, student drop-in centers, and then some type of mutual help group. And I think that there was definitely some evidence. We found some evidence to suggest that collegiate recovery programs, schools with collegiate recovery programs had higher GPAs, tended to have lower relapse rates, and tended to have a higher graduation rates. All of this research, none of it was causal research. All of this was correlational research. So I don't know that we can draw great conclusions from it, but that was really one of the conclusions that I had, was that we didn't really understand what was happening with collegiate recovery programs. And so along with this, the idea emerged that we really needed to, I really needed to write this K award so that we could try and understand or try and characterize the current snapshot of collegiate recovery programs. The only NIDA funded research that had been done over 12 years ago now, way back in 2013. And so we needed kind of a new snapshot of what these collegiate recovery programs across the US kind of look like. So this is the first paper that I wrote. The second paper that I wrote came out in 2022. And I'll come back to this later. I still believe that this is the best paper that I've written, or probably the most impactful paper that I've written regarding collegiate recovery programs. And it was actually inspired by a reviewer on the grant submission that I had. And their comment was that, this is all great, but you have no theoretical framework that you're working from regarding these collegiate recovery programs. And so, because I had no theoretical a simple socio-ecological model inspired by the work that was done by Bronfenbrenner many years ago, that really kind of shows us that these health outcomes that we're interested in operate in these context-specific environments. And so as you expand the environment, right, you start out with the individual that's in recovery, the very center of this very first circle. You start out with that individual in right in the middle, and then you expand context as you go out. And so in this case, we're talking about kind of some of the individual context, the interpersonal context, organizational context, and then community context. And so what that means for collegiate recovery programs is these are really the building blocks of recovery, and that they operate um, these forces operate on persons differently depending on that context. And so when we think about the individual, right, things like age, sex, personality, genetics, all of those things are going to be important to whether or not that person is going to be successful in long-term recovery. And then you go out one circle into their interpersonal context, and you need to understand the peer relationships, the family relationships, and all of those other first person relationships that that person kind of has that influences their recovery outcomes. And then go out another circle, and this is where the Collegiate Recovery Program becomes so important. But what kind of organizational contexts are available to that person? So what kinds of sober activities are going to be important? What kind of college health services, in addition to the Collegiate Recovery Program, are going to be being offered? What kinds of campus mutual help groups may be available to those individuals? And then you go out the last circle to the policy circle, and things like Medicaid expansion and decriminalization and availability of treatment services, those kinds of things are going to be influencing that person's long-term success. And so understanding context is extremely important for understanding student level outcomes. And if we don't have these recovery ready communities or recovery ready campuses, we really can't expect much recovery to happen. And so again, I always kind of lead or point to this paper to really try and understand how these collegiate recovery programs can operate on the individual in recovery. And every single recovery program is likely going to be different based on some of those contextual factors. So the next paper that I worked on, this is a paper. This is the third paper. This was a really interesting project. I got connected with a couple of researchers at DePaul, a couple of graduate students at DePaul University. And one thing that we noticed when we were constantly kind of looking through the literature is that there really was no number of collegiate recovery programs. We didn't have any citation or any reference that we could point to and say, this is how many collegiate recovery programs are kind of in existence. And so what a lot of people do, or what a lot of researchers and what I had done up until this point, was I just kind of sent people to the Association for Recovery in Higher Education's website and said, these people say that we have this many programs currently operating within the United States. So that's the number that we have. But again, that's not very scientific. And so what we really wanted to understand was, is this the actual number of collegiate recovery programs that exist? And what other kinds of services, or even if they don't have an official collegiate recovery program, are they offering any other kind of recovery supportive services that may count kind of as maybe not official collegiate recovery programs, but definitely as resources that would be important for a student's long-term success in recovery. And so what we found in this study was that there was 270 schools that offer, let me explain the methodology of this. And so again, these are experts in computer science that were way above my level as far as understanding kind of web scraping and some of those techniques to do research. But what they suggested that we do is we take every single website or every single available school all 4,578 or whatever there is within the United States. The U.S. Department of Education puts out a list every year of all of the schools that are out there, and we do a reverse website scraping or a reverse web search where we search for terms associated with collegiate recovery, and that's exactly what we did. And so what we found was that there was 270 schools, at least by their website presence, that offer some kind of recovery related resource at their school. There was 176, which was right in line, very, very close to what the Association for Recovery in Higher Education was reporting, but there was officially 106 collegiate recovery programs, and about half of these collegiate recovery programs had actual student drop-in centers. About 78% had sponsored sober activities, some kind of sponsored sober activities, and then 93% reported some type of mutual help group, so either AA or NA or all recovery or some type of mutual help group. And so this is the third paper that I was involved with for this K Award. A paper that is currently being worked on that has not been published yet, but I think will be a really good addition to the literature as well, is a paper that I'm working with a graduate student at Brandeis University. Her name is Ali Silverman, and we have access to the Healthy Minds survey, which is a huge national survey. I think the big survey has about 90,000 college students that take this survey every year. This particular question is in the substance use module of the large survey, which is not quite as big as the 90,000. I think they only get about 10,000, but still, a fairly large sample size. But of the 10,000 that complete the substance use module of the Healthy Mind survey, we're finding that right around, year after year, or at least in the last 3 years that they've asked the recovery question, right around 8 to 9% are identifying as in recovery from substance use disorder. And so again, we're kind of diving into what exactly that means, what that may look like as far as substances, and whether that's abstinence-based recovery or non-abstinence-based recovery. But again, this is just a good, I think, snapshot into the current number of or at least adds to the information that we have regarding the current number of students that are identifying in recovery. So the next part of this presentation, I'm going to talk about two surveys. One of them is a national survey of program directors. We had aimed to get about 50 program directors across the country from collegiate recovery programs. We ended up getting about 70 program directors. And so that's the first set of outcomes that I'll go through. And then the second national survey was a large survey of students in collegiate recovery programs. And we ended up with over 250 students in recovery, and I'll go over some of those outcomes. And then there have been three national surveys done in the past on collegiate recovery programs. The first one was, as I mentioned, was done back in 2013. That one was done by Alexandra Laudet and her team. And then a second study was done, a published study was done at Virginia Commonwealth. That was a national study done by Rebecca Smith and some of her colleagues at Virginia Commonwealth. And we'll look at kind of again, these are all cross-sectional studies, so it's not any kind of longitudinal outcomes, but we can look at some of the changes from these previous surveys that have been done regarding these student groups. All right, so as I mentioned, this first section we'll talk about the program directors survey. Again, we had about 70 program directors. You saw that there was 176 potential collegiate recovery programs out there. So a little bit under half of the total collegiate recovery programs, but still a fairly good sample. And so this is the fourth paper, and this was collected and published back in 2024. As you can see, large majority of the schools that participated in this study were four-year public universities. A very low showing, I would say, of HBCUs. Only about 4% of HBCUs had collegiate recovery programs, and only 30% provided some kind of recovery housing. And so, and I realize that this next part of the slide is likely very hard to see, but I'll try and explain what's on here. Again, it's hard to see, but these are the different types of mutual help group meetings that were provided at these collegiate recovery programs. And going into this, if I were to have guessed what the most popular mutual help group meeting at collegiate recovery programs was going to be, I would have guessed that far and away AA, Alcoholics Anonymous, would likely be the most the ones that would be happening on most campuses most often, just based on kind of the history of recovery in this country, and that AA is a fairly prominent self-help group that has been used for individuals in recovery. And I think surprisingly, for me at least, was that 63% of these programs had what are known as all recovery meetings. And so if you're like me and you had never heard of all recovery in the past, you're not alone. If you go to the literature, there's not, I'm still yet to see very much on all recovery meetings in the literature. I can tell you that anecdotally, these are very popular on college campuses, generally because of the name itself, right? All recovery. It's any recovery pathway that a person has. Basically, you say that you're in recovery and you can attend an all recovery meetings. And so these tend to be a little bit more popular for individuals with eating disorders, or maybe are taking medications for opioid use disorder as part of their recovery, or maybe mental health addictions, or not addictions, maybe mental health issues and recovery from mental health issues, or maybe internet or gaming addiction type of issues. Maybe just in general, maybe a more welcoming spot for those kinds of issues that a person may have. And then again, I think surprisingly, for me, again, that 16% of these collegiate recovery programs had meetings specifically for individuals with eating disorders as well. And so a very nice, I would say, kind of a plethora of different types of mutual help group meetings. The last thing that we wanted to do with this study, and again, if anyone is interested, I can definitely lead you to this publication. This one of the things that we know that is really important with collegiate recovery, just generally speaking, is funding. We felt that it would be too intrusive to come out and just ask, like, how much money do you get from different sources to fund your collegiate recovery program? And so what we wanted to do was we wanted to kind of understand maybe what we were considering sustained funding and maybe unsustained funding, with this rationale being that schools with maybe more than one type of funding stream is going to be able to weather like unstable funding, or maybe losing a funding source. And so we asked what type of funding streams each of these schools had. And so this is just a breakdown of the schools reporting that having these different types of funding. And then how we ended up breaking schools into two was we took schools with only one funding source and then schools with two or more funding sources, and we looked for differences between those programs. And so again, you can see here that we have we have what is listed in these columns is schools with more than one funding source, two or more sources of funding, and then the differences kind of between them. And so that you don't have to squint your eyes, I'll just highlight the differences between these schools. And I don't think it's very as you would expect, I guess I would say, is that the schools with more than one funding source generally had program directors that had been at the school much longer. They generally served more students. They were more likely to have a physical drop-in center, and the physical drop-in centers that they had were more likely to be larger square footage wise in the schools that had more than one funding source. And so again, kind of a no-brainer, but again, we really wanted to try and understand just how big of an issue or how important sustained funding was for these collegiate recovery programs. So that's the program director survey. I'll now move on to the student survey. This fifth paper is actually currently under revisions, right? Or it's under review, revise and resubmit at the Journal of American College Health. I'm hoping to get the notice any day that has been accepted for publication. And again, I'm just going to go over some of the highlights here. There's way more results in the full manuscript. And so with this first slide here, I think that one of the things that really just kind of jumps off the page is the number of LGBTQ plus students. So just about half of individuals, and again, this was 200 individuals, 226 individuals in these collegiate recovery programs. Just under half reported that they are LGBTQI students. So a very high proportion of LGBTQI students in collegiate recovery programs. The next slide, like I mentioned, is kind of looking at some of the differences across time. As I mentioned, there's the 2014 Law Day study, there's the 2021 Smith study, and then this most recent study from 2024. And again, I'll just kind of go through and highlight some of the differences that really kind of jump out to me. You can see that racial disparities wise, you're seeing kind of a decrease or an increase in more minority, Black and brown individuals participating in collegiate recovery programs. It was 91% white individuals back in 2014. You're seeing that number slowly decrease across time within collegiate recovery programs. The sexual orientation question, that particular question was not even asked in 2020 or in 2014 by the Law Day study. You can see that the 2021 study it was about 60%, and as I just mentioned, it's just under half or just over half individuals reporting that they are straight or heterosexual, and again, a huge, I would say, a fairly big jump over time. You're seeing a lot more graduate students in collegiate recovery programs over time. And then one that is a little bit interesting for me is that you're seeing a decrease in individuals with criminal justice involvement across time. The only thing that I can say that maybe impacting this number, I would say, is the kind of the decriminalization of marijuana over the last 10 years, that you're seeing maybe less arrests for individuals in these collegiate recovery programs. And then lastly, one thing that's not listed on here, but I did find interesting in our study, is that about almost 60% of individuals in these collegiate recovery programs had utilized financial aid, which again I think kind of speaks to the student population in these collegiate recovery programs. So the next slide is these are first of all, these are not mutually exclusive. So you could self-report many different pathways, but we asked individuals to identify their pathway to recovery. You can see that 57% said that their pathway was abstinence 12-step based, but you also see a large majority or a large number of individuals or percent of individuals that are reporting harm reduction pathways, that are reporting non-abstinent pathways, moderation management pathways. So these different types of pathways to recovery. When asked about what substance use disorder they were in recovery from, or what they considered themselves, what condition they considered themselves in recovery from, you can see that about 60% identified as alcohol use disorder, 70% as substance use disorder, but then a large portion also saying mental health disorders, disordered eating, and then process disorders. And that was kind of a category that we lumped together for people with gaming addiction, internet types of addiction, and sex addiction. And then lastly, probably one of the most interesting findings, and this is a huge change, and I realize I didn't put it on that first slide, but if you look at the Law Day study back in 2014, it was about 85% of individuals that said that they had been to a substance use disorder treatment in their lifetime. In our study, we only found that just over half of individuals were stating that they had been to substance use disorder treatment or had some history of going to substance use disorder treatment. And so when you go back to the very first slide that I showed that continuum of care, right? Prevention, treatment, recovery, you're having a whole bunch of people that are in recovery that have skipped over that treatment part of the continuum of care. And so why this is important to me as a former substance use disorder counselor is because that less than half of these individuals in collegiate recovery programs are showing up with, I think, some of the foundational principles or foundational therapies that we see in treatment, at least in this country, right? And so skills like relapse prevention, some mindfulness techniques, cognitive behavioral therapy, those kinds of things, a lot of people are maybe coming into this without some of those skills that can be important to long-term recovery. And so not that it's a bad thing, it's just something to kind of think about when we think about services that we may want to implement within collegiate recovery programs. And then this last little outcome is mental health diagnoses. And you can see that there are many individuals in collegiate recovery programs that are reporting depression, anxiety, and other types of mental health, lifetime mental health diagnoses. All right, and this paper just came out a few ago. This is a group of individuals, or a group of researchers that I worked with at the University of Missouri. I think this is a really interesting paper. Missouri is actually a state without a recognized collegiate recovery program, but these individuals this group of researchers were really inspired by the socio-ecological model, and so they wanted to kind of put that socio-ecological model into practice, and so that's why they reached out to me to help with this particular paper. And what they did in this paper is they took they have national, or they have a statewide survey in the state of Missouri called the Mock-B survey. And as part of that survey, all schools are required to participate in this survey. All schools in the state are required to participate in this survey. And what they do as part of their survey is they require all of the schools to submit their strategic plan for substance use disorder. And so what these researchers did is this strategic plan is basically a document that aligns with Drug-Free Schools and Campuses Act, and it's like I say, it's a required document that says what their plan is to combat substance use on campus over the next few years. And so what these researchers wanted to find out, or what was really important to them, was they want to do a qualitative research project examining these documents. And so they did a qualitative analysis for what they consider recovery supportive language within that document. This is at 23 schools. And there was over 16,000 students or at least within the Mock-B survey, they had surveyed 16,000 students at these universities as well. And so they put these schools into three different categories. The first category was for schools, and again, this is a state without collegiate recovery programs. The first category was schools that were planning on starting a collegiate recovery program in the next few years. And so what they termed those schools was an enhanced recovery school. And then the next category of schools was anything that mentioned any kind of recovery supportive service within their strategic plan. And so this would be services like, we plan to have an AA meeting on campus, or we plan to do substance-free activities, or we plan to do peer ally, or recovery ally for our students. And then the third group of schools was schools that had zero plans of doing, in their strategic plan, had zero plans of doing any strategic planning around recovery services. And so this first slide, you can see the number of schools, or the percentage of schools that were in the enhanced recovery group, the basic recovery, and then what they considered the recovery inactive schools that were not planning any activities. And this first, again, this is just a repeat of what was on that last slide. This next part really this next group of outcomes was, this particular research group was really interested in other students' awareness of recovery services on campus. That's what they found that was kind of inhibiting individuals from even knowing that there was any kind of recovery services on campus. And what they found was that was exactly true, was that it didn't matter if you were at an enhanced university school, a basic university school, or an inactive recovery school. It didn't matter. Pretty much nobody had heard, or nobody was aware of the school's recovery programs. And so it happened to be a little bit better at schools that had enhanced programs, but again, not what we would expect to see as far as student awareness around these recovery events. And then in their next analysis, they were looking at recovery supportive strategies. And so with this particular one, they left off. There was obviously nothing for recovery inactive schools. But when they looked at differences between the enhanced and the basic, they again kind of found some differences between level of awareness of substance-free events, of referrals to treatment, and then differences in allied trainings available at these different schools as well. And so again, it was just kind of a fresh take on using that socio-ecological model to try and understand student awareness of collegiate recovery services within the schools in this state of Missouri. And then this last this last set of slides, there's no paper associated with this yet. This paper is currently under construction. We're currently working on this particular paper. But one of the aims of the K Award is to look at is to use implementation science to try and better understand mutual help groups within collegiate recovery programs. And so this is a CFER, so for all of my implementation science people out there, this is a CFER based examination of mutual help groups within CRPs. And this paper will be soon. I'm just going to talk about two quotes from this qualitative work that I felt were really, really important for kind of understanding collegiate recovery programs. And so this was mentioned as a facilitator by a collegiate recovery program director, but this is mentioned as a facilitator to these mutual help groups across campus. And I'm just going to read it right off of the slide. So in the same way that mutual aid groups provide people not in academic settings, so that it provides that same sort of accountability, a place where they can go and be of service to others. One of the things that we love about this for our students, the students are actually the ones that develop and chair the meetings. They're not done by staff. They're not done by anybody other than the students. And again, this is a program director at a Southwestern university. And then this quote was from a vice dean of student affairs at a Midwest community college. And what he went on to say was, our students are actually able to say, I was seen and respected and cared about, and support was there when I needed it. And that's the hallmark of a successful program. And so again, as I was kind of going through some of these exemplary quotes from this very large number of interviews that I did, these two quotes really, really kind of stood out. And so I wanted to kind of share them as kind of examples of how important these collegiate recovery programs can be on these campuses. And I already mentioned this earlier, but I think that, you know, in going across the country and doing this qualitative and quantitative work, you know, I've visited 5 different programs across the country. I've published these and many other papers on collegiate recovery programs. And again, I think what I keep coming back to really is the importance of this socio-ecological model. It is impossible to understand the student experience without understanding the context that they're in, whether or not they are going to be successful in long-term recovery. And the more recovery ready a community or a college can be for these students, the more likely these students are going to be successful long-term. And that's another thing that I always just make sure I harp on. You know, I know that people think that they want these really easy outcomes as far as prevention, treatment. We just want people better. And you know, we want these really easy outcomes with the recovery phase of the continuum of care. And it's not, these outcomes are not really, they're very hard to kind of capture. And I always say they're not individualized, they're community outcomes, right? Your school level outcome that really is the important part of this. If a school, it's the school that's got to be ready for these students. And that's when students are going to be successful. So are we setting ourselves up for success within these institutions of higher education across this country? And so I'll leave everyone here before we jump into questions with what I consider hope. And so I'll just kind of talk for 2 seconds kind of about why these programs are exceptionally important to me. I think that I bring a lot of very unique perspectives. My work is informed by a lot of previous experiences that I've had. For 5 years, I was a substance use disorder professional or a drug and alcohol counselor at a treatment center on the east side of Washington State in a little town called Richland, Washington. I'm a person in recovery. I've been in recovery for over 23 years. And I'm also a person that is formerly incarcerated and spent many years in the Nevada Department of Corrections as well. And the reason that I bring these perspectives to everyone's attention is that these collegiate recovery programs, these programs offer real solutions to some of the most pressing societal issues I would say that we have today. I think that addiction is one of those issues. I and many other people are living proof that when recovery support services are delivered with intention, and especially in college settings, they don't just save lives; they change them. These programs gave me and many other people not only the chance to survive, but to thrive in college settings. I would also say that when we talk about the next generation of professionals, they help to train that next generation of professionals, and that group of people can lead, ideally, with their shared experiences of addiction recovery. And so with that, I will end my presentation, and I will open it up for questions. If anyone wants to reach out to me, I'm on LinkedIn, social media there. You're also more than welcome to reach out to me by email as well. More than happy to get on a call and chat through some of these things. If anybody wants any of these papers that I presented, more than happy to share any of these papers and send them out.
Thank you so much, Dr. Vest. That was really interesting, and I really appreciate your sharing your personal experience, which I think lends such a meaningfulness to all of this as well. We do have one question so far. Lots of people saying thanks for all you do. Plus, a student of yours at Wazoo has jumped into the chat if you want to check that out. One question that we got was in reference to the second study, the student survey that you were talking about. Oops, got pushed up. Here it is. They were asking, you were on the recovery pathway slide, and they asked, how does reduction in stigma allow folks to enter recovery earlier in their addiction?
Oh, man, I mean that's a really hard. I mean that's a question that I could honestly I could probably take 3 hours to try and answer it, and I don't know that I would do a really great job of that. And that's why I really drive home that socio-ecological model, because every college campus is different. I think stigma operates in a way that can be context specific. One thing that I see stigma operating in my daily activity here at Boston University. I see it, constantly in all of the work that I do. I don't know how to measure stigma. I don't know how to overcome stigma, but I think that it is one of probably the most profound things that we deal with when we talk about substance use disorders in this country. And so, if your question was how do you overcome it, I don't know. I don't have a great answer for you. I think that we're all kind of in a learning phase more than a knowing phase regarding stigma. And, hopefully, I would say in the next few years, we do have a little bit better handle, and we find better ways to talk about. I think we're guilty of it in the research community as well. I think that hopefully we find better ways to talk about it. I know that there's big pushes to use non-stigmatizing language, but it's not always followed. And I think that those things kind of come and go with the wind, right? They're considered kind of political correctness or those kinds of things that can again kind of come and go, and sometimes they're popular and sometimes they're not so popular. And so, but again, I really hope that we can in the next few years figure out ways to overcome stigma.
Great, thank you so much. Next question, what are the next steps in this line of research?
That too is a really good question. So as I'm thinking about the next iteration of grants that I want to write, I think a couple of things have come to me that I never thought would have come to me, before I had done some of this work. One thing that jumps out to me is what I presented on all recovery meetings. If you'd have asked me a while ago what I thought would be the most popular, I would go with what I know or what I've heard, which is kind of the 12-step mutual help groups that are out there. But to hear that all recovery meetings are the most popular among collegiate recovery programs, I want to understand why. I want to understand what is so unique about those particular groups. Again, I can guess all day long, but I don't really know why they seem to be so popular on college campuses. And so that is one area that I really want to kind of dig into. I think that collegiate recovery programs are a good place to measure those. I also think, they're also popular at the Phoenix workout gyms that are for individuals in recovery. And so maybe do a study there. And then they're also popular within recovery community centers. And so trying to understand in these different contexts why people are preferring these all recovery meetings as opposed to some of the tried and true 12-step meetings. I just would love to understand that. So that's one area of research. I think another, just a follow-up to this study, right? I think we did a great job of characterizing collegiate recovery, but we didn't do a great, well, it wasn't part of the focus or the aim of this study to see if collegiate recovery programs even work, right? I mean, is there a difference between schools that have collegiate recovery programs and schools that don't? I mean, are students able to sustain their recovery longer? Do they have better recovery capital? Do they have some of these things that we associate with long-term recovery in these schools with collegiate recovery programs? And so, just trying to come up with a scientifically sound way and ethical way of kind of answering that question is I think kind of next on my list to do. And so those two things those two projects are, I would say, probably top of my list to work on next.
Great, thank you. We have two questions related to the low representation of racial and ethnic minorities in recovery programs. One is, what factors do you think contribute to that low representation? And another is, are the low numbers proportional to enrollment numbers?
That's a perfect. It's like you read my mind with the continuation of that. So these numbers are actually better than what we see in higher education in general, as far as representation. And I didn't present it, but I can definitely send you the paper if you're interested. And we do talk about that in the paper. And so I think that there's little doubt that there's a problem in higher education. We just see lower numbers of racial minorities in higher education in general. And so these findings are, they're not what we want to see, but again, they are, I think, a little bit better than historically, at least with the Department of Education numbers that come out every year. They're better than what we see historically. But again, the number of LGBTQI. So if you believe, or if you look at the last numbers from the Department of Education, it was around 24%. Or 20 to 25% individuals that are identifying as LGBTQI, but a huge number in collegiate recovery programs are identifying as LGBTQI. And so that's another area that I really love for, to bring some people in and start looking at some of those outcomes as well, and diving into some of those numbers as well.
Mm-hmm. Next question is, oops, it jumped. What is your take on, and are there any studies on MAT services for students?
Yeah, it's a really good question. So there is some work out there. I think that, well, first of all, let me just say that opioid addiction in general is very, very low among college students, just generally. It's well under 1% of individuals have opioid, like pure opioid addiction. And so that number is very, very low. I do believe that, and again, this is just anecdotally, I've known people in collegiate recovery programs that have been on medications for opioid use disorder. But as far as a study out there that is, tracks the number of individuals, I don't know of a study. I did see a qualitative study that was done that asked about attitudes from students in collegiate recovery programs about uh, uh, individuals on medications for opioid use disorder, and just generally speaking, and we found this in the qualitative work that we did as well, is that everybody is very supportive of students on medications for opioid use disorder within collegiate recovery programs. In fact, I expected the stigma numbers to be actually a little bit higher within the qualitative work that we did, but again, we just didn't see it. We didn't see this the stigma against medications.
Interesting. All right, next question. Why do you think there is such a small uptake of collegiate recovery programs in HBCUs?
Another very good question. So I've talked to someone that is kind of a program director at an HBCU, and I think that they're yeah, I don't have a good answer for you. I mean, her thought was that the word recovery kind of means something different within the communities at her HBCU, at least. And so I think that a lot of times, again, kind of these terms are the terminology is culturally sensitive, in that the word recovery can mean something negative in different contexts, and that's what her general consensus was, that individuals in HBCUs don't like the word recovery. I think even just calling it something different, or saying that you had a problem but now you don't, but not calling it recovery. She felt that there would be so many more people that would identify with that, and so I don't have a good answer for you as far as the number of HBCUs. There's definitely not enough work in that area. I mean, I think my study was the very first one that even asked about it, quite honestly, and so there's just so much more work to do in that area.
Okay, next question, kind of going back to what you were saying before about opioid use disorder in college students. Someone asked, are there studies on the number of people who may have dropped out of college due to substance use? Are college students less likely to use opioids, or are college students using opioids less likely to stay enrolled?
I would say all of the above. And as far as research out there, I'm sure there is research out there. I may not just be aware of it off the top of my head, that tries to capture how many students drop out of college due to opioid use disorder. Yeah. I don't know that, but I think that all of the things that you explained could be reasons, but without real research in that area, I don't know that we know that for sure. But I think all of those could be reasons that people are not continuing on in school, or maybe not being captured within collegiate recovery programs because they don't feel comfortable in those settings.
Interesting. Lots of comments going on. I'm not seeing any other questions. Does anyone have any more questions for Dr. Vest? Give it a couple minutes. I will say several people. Oh, sorry. Go ahead, Dr. Vest.
I was just going to put my, for anyone that didn't get it off the slide, put my email address in that.
Great. And I was also just going to say, I've seen several people talking about being interested in starting a recovery program at their university. Do you have any advice for anyone who is thinking about trying to do that? What, like,
Yeah,
a good first step?
Yeah, for sure. I'll put the Association for Recovery and Higher Education's website in there. I'm not affiliated with them at all, but I do know that they have a technical outreach grant that they have, and so I think that they can you can just contact them and they'll be able to just set up and it's totally free, but it's just kind of to set up a technical um, how do you call it? Let me see if I can find it here really quick. It's technical support, and so that you can kind of find out more about collegiate recovery. You can find out what it takes to start one, all those kinds of types of things. But they have a technical support grant. I think I saw someone put in there about the definition of SAMHSA's definition, and there are many different kind of definitions of recovery. SAMHSA is definitely one of the I think a good definition of recovery that gets it more into kind of the recovery capital types of things. But I believe that they have a grant through SAMHSA that allows them to provide technical support to any colleges interested in starting a collegiate recovery program.
Wonderful. All right. Any other questions for today? All right, just a reminder, I'm going to send you an email in a little bit with a link to the slides, and the recording will be up probably tomorrow. And I'll also collect Dr. Vest's email and the resource that he just shared and put that in the email as well. Thank you, everyone, for coming. Thank you, Dr. Vest, for that really great presentation. We really appreciate your
Yep.
time.
No problem. And Meg, I will send you all the papers that I
Oh, wonderful.
presented to you
Okay,
today. So you could send those out to everyone as
great.
well so that people can kind of dig into that
That would
research.
be great. Thanks so much. All right, have a great day, everybody.
All right.
See you later.